For Central NJ commuters and workers, back pain can feel like a constant draining battle. But what if the surgery you were recommended is unnecessary for 6 out of 10 people? The reason often begins with a misunderstanding of one powerful tool, the MRI. Those abnormalities on your scan. They can be normal signs of aging, not the cause of your pain. I'll show you how to see your MRI clearly, know the risks, and find a trustworthy Central NJ second opinion. So, what is an MRI? It uses powerful magnets and radio waves to create detailed pictures of your spine's soft tissues, without radiation. Your report might say disc degeneration or spinal stenosis. These sound alarming, but they represent a wide spectrum of conditions. Here's the critical point. Many people with zero back pain have these exact same findings on their MRIs. A bulging disc can be totally painless. The image itself is just one piece of a much larger puzzle. It doesn't tell the whole story of your specific pain. That's why interpretation is everything. It leads to a vital medical principle: clinical correlation. Clinical correlation means a good doctor treats you, the patient, not just the image. They must connect the MRI finding to your actual symptoms. When that connection is weak, surgery can be aimed at the wrong target, fixing a disc that was never causing the pain in the first place. So what happens when that step is skipped? The consequences of rushing into surgery based only on a picture are more severe than you think. First, the immediate risks. Even in a successful surgery, you face the possibility of blood clots and pneumonia. Then there are serious infections that demand more procedures. And in rare instances, permanent nerve damage or worse. Even if you avoid those, you could face failed back surgery syndrome, where the pain never leaves or comes back worse. The answer to our question? Up to 40% of patients are left with chronic pain, becoming a statistic of this very syndrome. This is a bleak picture, but the good news is for many people, surgery is not the only option. It shouldn't even be the first. A whole arsenal of powerful, non-surgical options exists, including targeted medications and advanced pain-blocking injections. Physical therapy is a main component. It's not just stretching, it's actively strengthening the core muscles that support your spine. Modern treatments also involve nerve stimulation and even cognitive behavioral therapy to reframe your relationship with pain. With a misleading MRI, risky surgery, and multiple alternatives, how do you choose? This is where a second opinion becomes your most powerful tool. Recall how normal aging can look alarming on an MRI. A second specialist can confirm if that finding is the real source of your pain. And that 60% statistic of unnecessary surgeries? A second opinion is your single best defense against becoming part of it. Beyond the medical facts, it provides something just as valuable: peace of mind. You gain confidence in your final treatment plan. A second opinion is clearly needed. But not all specialists are the same. Here's what to look for in the Woodbridge area and Central NJ. First, check for top credentials. Your surgeon must be board certified in neurosurgery or orthopedic surgery. This is non-negotiable. Second, ask about their experience. A high volume of annual spine procedures is frequently linked to better outcomes and lower complication rates. Finally, what is their treatment philosophy? A great specialist wants to keep you out of the operating room if at all possible. In our area, you have surgical practices like NJ Spine and Orthopedic, with facilities located near Woodbridge for that side of the equation. For non-invasive strategies, there are centers like Northeast Spine and Wellness in Woodbridge. Seeing both gives you a full perspective. So we've seen how an MRI can be misread, the serious risks of unnecessary surgery, and the power you gain by getting an expert second opinion. The image on a screen does not define your future. Your pain is real, but your recovery path should be guided by wisdom, not just a picture. If you've been told you need spine surgery in Central New Jersey, just pause. Ask questions, understand your MRI, and always get a second opinion. It's your health. Be your own advocate. Don't become another statistic. For more guidance, consult New Jersey's top spine specialists.